All right. You. Yeah. Now, where's our speaker? Comment. Her name is Carly.
Focusing in on
yeah, that's the canister.
Okay. We just need to. How would does the connect to the computer wirelessly?
Yeah.
No, that's the
Clicker.
Run out of USB port.
Waiting to be let in. People are still waiting to be let in.
All right, so we've got that connected there. All right. Oh, there we go. It's working.
Oh, she's in.
Okay.
And then I guess at a certain point, I'll just allow share screen.
Yeah.
Somehow or another,
The speaker's in. So I think
there is a way to.
there's Carly right there. Oh, she hears me talking. Okay. And then I guess when it's time, we'll just allow her to share screen, or I can just go ahead and give her permission.
I guess I should go ahead and start.
Do we have a slide deck from
She does have one.
the road, which is usually the slide deck? Is there any slide deck for today's meeting?
Am I already? I think they're about to use this line.
If we have to go with it like it is.
I think unless Valerie.
Share this. How did you get Carly permission to share this?
One thing we can do, need to get somebody, but there's a way to focus the output line.
Yeah, we're gonna have to keep managing. We gotta make sure you record too. We gotta make sure you record too.
It is actually. The only question is, I don't want to.
Well, I mean, supposedly, once I get going, there is a way.
Oh, actually, you should be good after it started.
Once everybody's quiet, it should automatically kind of focus on the speaker, and we'll hope for that. There is a way to manually control it, but you have to have an app, and I think Always wear
I think we're ready.
All right, can everybody hear me okay? How about you guys in Zoom land? Can you hear me okay? All right. Greetings, everyone, and welcome to the May 17, 2021 meeting of the Rotary Club of Raleigh. Welcome to all of you. It's so great to see all of the faces here in the room and all of the faces up there on the screen. We are just loving this hybrid format. It's been a little interesting today because our typical master of technical ceremonies, Valerie, got caught up in a little bit of traffic and she's not able to be here. But we are making it work. We are so happy to be here today. My name is Eric Stevens. I am, at least for the next few weeks, still the president of the Rotary Club. And thank you so much to Charles for filling in for me for the past couple of weeks while I was sick and on vacation. You guys are going to be in great hands next year with Charles at the helm. But I'm going to hold on to my gavel here since I'm finally getting a chance to use it for the next few weeks. This is a great meeting here today, and we are so fortunate that this is our opportunity to present the Wilson R. Heyman Vocational Service Leadership Award, and we have a wonderful recipient, Van Uer, who's going to receive that award today. We're looking forward to that presentation. And in addition to that, we also are going to hear from Dr. Carly Eckert there on the screen. And she is going to be talking with us about Greenlight Ready and the amazing work that she does and that her company does just a little bit later on today. But for now, we will begin the presentation with the invocation and pledge from Richard White.
Would you all just stand for a moment, please? Today's invocation is entitled Credo by Roy Ning. Mix a little shake of laughter in the doings of the day. Scatter golden bits of sunshine as you plod along the way. Stop to cheer a fellow human that's a bit worse off than you. Help him climb the pesky ladder that you find so hard to do. Show by every daily motive, every thought, and every deed, you are one that folks can turn to when they find themselves in need. Just forget the rugged places, make believe they're slick and smooth. When you spot the troubled faces, pull a grin and try to soothe. Life's a game, a mighty short one. Play it gamely while you can. Let the scorebook show the record that you measured up a man. Pretty palms and marble towers won't avail you much when you've passed unless you've helped to lighten heavy loads and such. Better far to have your neighbors say you were a cheerful chap, always kind and always helpful. If you're that, you'll leave a gap. You may scatter filthy lucre to your merry heart's content and forgotten be much sooner than some good souled homeless gents. Chances are that in the making of your sordid pile of cash, in your hand clasp, you were faking, though you did show a pep of dash. Never mind about the fortune you made up your mind to pile, but just live the golden rule, lad, and your life will be worthwhile. Would you please all join me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesty, above the fruited plain. America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea.
Thank you, and the word was indivisible. So sorry about that. Eric.
All right, thank you, Richard, for that great invocation, and thank you, Sevlin, for singing for us. We tried to be a little chorus here for you in the room, and we'll keep trying that going forward. So thank you so much. At this point, we'd like to introduce guests. Anybody in the room? Let's start with anybody in the room. Do we have any guests in the room besides Van? We'll talk to Van later.
It's my sister Mira.
Okay.
She moved down to Raleigh about 3 years ago. We work together now. She's at Penn State University with Nittany Lions. And her husband's recently retired from the State Department. And she has lived in 7 countries throughout the world. Some pretty awesome places. So, but back here for good now, and happy she was able to make it.
For those of you at home, if you couldn't hear, that's Peach Tony's sister Mira. Welcome, Mira. And I know we have a couple of guests that are on the Zoom call. Chet, you want to introduce yourself?
Hi, Chet Marksell, Linktel, new to Raleigh. Glad to be participating in the meeting.
Thank you so much. Glad to have you, and please come back anytime, and feel free to join us in person or online at your convenience. Any other guests that we have today? All right, everybody, please remember the cart buckets are on the table for those here in the meeting hall. And if you are on Zoom, please send an email or a chat to Linda and make your donations to the cart bucket for Alzheimer's research. Do we have any happy dollars? All right, hearing none, let me go ahead and make a few announcements. Next week, we will be on Zoom again, and our speaker will be Ken Strange. He is going to be giving us an interesting presentation about his pilgrimage along Spain's Camino de Santiago path, which would be fascinating. Then on the 31st, we have no meeting. We'll take that day off for Memorial Day. And the following week, June 7th, we will be hearing from Christopher Mead of Podcast Abbreviated. And now at this point, we will move on to our award presentation. So I see Van Eur smiling there at her table. And this is the Wilson R. Heyman Vocational Service Leadership Award. The purpose of this award is to honor the driving force of Rotary, which is service above self. Specifically, vocational service is the second pillar of Rotary's 4 avenues of service. The concept of vocational service in Rotary calls on Rotarians to encourage and foster high ethical standards in business and professions, the recognition of worthiness in all useful occupations, and the dignifying of each Rotarian's occupation as an opportunity to serve society. Annually, our club awards our Vocational Service Leadership Award to a worthy community leader. The purpose is to recognize non-Rotarians in the community who exemplify integrity and high ethical standards in their vocation and who use their vocational talents to serve the community. Nominations can only be made by active members of our club. Past award recipients have included Dr. Knox McMillan, Dr. Lawrence J. Wheeler, the late J. Gregory Poole Jr., Dr. William Dunlap, and Doug McMillan of the YMCA. This year, in memory of our longtime distinguished member who passed away this past fall, Wilson Heyman, who was my law partner and good friend and who very much exemplified all the ideals of this award. We have renamed this award the Wilson R. Heyman Vocational Service Leadership Award. This year we had 13 wonderful nominees submitted by our club members. All of them had qualities that exemplified Rotary's motto of service above self. First, I want to thank all of you who submitted names. And I want to thank the review board members who had a particularly difficult task this year. So thank you, Dana Johnson, Mary Moss, Jim Dorsett, Racine Mitchell Sinclair, and Kevin Summers for your commitment and diligence in selecting this year's award recipient. They did a great job. I'd also like to thank our board member, Mark Hackett, who has done such a wonderful job every year in handling all of the work that goes into the giving of this award. From soliciting and organizing the nominations to coordinating meetings with the review board members to handling all of the little details that will make today's presentation go smoothly. So each of our award recipients is presented with a Rotary Club of Raleigh crystal plaque and a Paul Harris Fellow pin, medallion, and certificate. And at this point, I would like to ask Jim Dorsett to come to the podium to tell us a little bit about this year's recipient and to give her her award.
Eric. Well, first, fellow members of the Rotary Club of Raleigh, I can't tell you how good it feels to be in the room with you in person, seeing all these brilliant faces, all these good folks in person. Yeah, this is how I dress every day for the past year. Just like this. No, this is about the third time, other than being in court. So this is a great honor for me to be able to introduce this year's winner of the Wilson R. Heyman Vocational Service Leadership Award, because I've known this recipient for my entire life. And I have only good things to say about this young lady. And that will be the case because she gets the microphone after me. So I'll be particularly circumspect. But Van is much younger than I am, but we knew each other growing up and in high school, and she was on everyone's most admired list during those early years, and she continues to be on everyone's list of most admired people in this community. Van and I share a love of travel and adventure. In fact, we were overseas during the same time period, and Van was in Kenya after finishing at St. Mary's and UNC Chapel Hill. And in Kenya, she taught English at a high school in Kenya, and then she founded an elementary school in Kenya and taught there. She was there from 1978 to 1982. So a fascinating time, and she could take a whole hour and tell us about her adventures in Africa. But she grew up during high school and college waiting tables at the Angus Barn. She learned the business from the ground up. She's the daughter of the late Alice Ewer and the late Thad Ewer Jr. And she's married to Steve Thalhauser. And they have a daughter, Allie, and a son, Christopher. Now, since returning to Raleigh in 1982, Van continued to work her way up the chain at the Angus Barn, and she became general manager in 1988 upon the untimely death of her father, Thad Ewer Jr. She and her mother ran the business for 9 years, and then after her mother passed away, she's continued to operate the business with some significant help from Steve, who I've seen in action. He does a phenomenal job. The Angus Barn is one of the larger employers in the area. They employ over 400 people. And get this, they seat 725 people in the restaurant. They can seat up to 1,000 people in the Lakeside Pavilion. And then they have another 400 they can seat at Bay 7 of the American Tobacco Warehouse in Durham. Van has been active in the community in so many ways, I really can't list them all. But one of the things that she's been particularly active in is the Walk for Hope, for the Foundation for Hope, of Hope. But she's also done other things, Board of Associates, Theater in the Park, which is a great cultural amenity for our area. She's a Board of Advisor member for the North Carolina Sports Hall of Fame, and she's a board member of Golden Corral. She's Director Emeriti of the National Restaurant Association. Now, Van has been presented with many awards. Having done some research on these awards, there are too many to list here, but I'm just going to run through just a few because we want to have an opportunity to hear from Van. Van has been awarded the Executive of the Year Award, the YMCA's Academy of Women Award, the Griff and June Glover Award for Distinguished Service, presented by the North Carolina Restaurant Association, the Restaurateur of the Year Award, the John Ross Award, presented by the Greater Raleigh Convention and Visitors Bureau. She's been featured on CBS 48 Hours. She's received the Humanitarian of the Year Restaurant Neighbor Award, the Gold Plate Award, and one that I think she should be particularly proud of, in 2005, the Environmental Stewardship Award for Conservation and Minimizing of Waste. Also, the Excellence in Education Award, Excellence in Community Mental Health Advocacy Award, presented by the University of North Carolina at Chapel Hill, her alma mater, and for her work in caring for people with mental illness. In 2019, the year before the shutdown, she received the IFMA's Legends Award for a lifetime achievement and contributions to the food service and hospitality industry, and the Raleigh Hall of Fame Award. So at this time, I would like to ask Van to come forward, and I would also ask Eric Larson, our foundation chair, to come forward and assist me with the presentation. Van, if you'll come forward and stand to my right. Van, it is a great pleasure and privilege to present you with the 2021 Wilson R. Heyman Vocational Service Leadership Award. This is in recognition of your many contributions to Raleigh and the greater community for a lifetime of service above self. So Rotary's motto is service above self. And you have exemplified service above self through your vocation and using your vocation as a means to serve citizens in our entire community. So not only is the Angus Barn one of the best places to eat in the country, Van has also used her talents and her vocation to serve our citizens, as you have just heard. And so this reads, presented to Van Ure in appreciation for your distinguished service to the Raleigh community, May 17, 2021. And now I'd like to ask everyone to stand and give our recipient a round of warm applause. There, and I'd like to recognize Eric Larson, the chair of the Rotary Club of Raleigh Foundation, come forward, and he's got a special presentation for Van. As does our president, Eric.
Thank you.
Stevens.
So the Rotary Club of Raleigh Foundation and the Rotary International Foundation are funds that work all over the world. And I knew that we were going to be making this presentation for you today. And I was at one of our local excellent restaurants. And I was thinking about what would I say about those. And between the cheese spread and the Chateaubriand, it came to me that a lot of us might not know the background of the Paul Harris Award. And so my good friend Mark Hackett had written up something beautiful. So if you don't mind me reading, let me read the background of this award that will be presented to you. And Eric Stevens, our president, has the pin, the medallion, and the certificate that goes with us. So Rotary's Paul Harris Fellowship Program was established in 1957 and named after one of Rotary's founders, rather. And it recognizes individuals who contribute or who have contributions made in their name of $1,000 or more. The Rotary International Foundation, these contributions support our annual fund that does work all over the world, a lot of it, an area you're interested in, and that is in education. We do a great deal of education work around the world. So this provides vocational training for teachers in Africa, water filters, toilets, hygiene products all around the world, scholarship fund for medical professionals around the world, peace centers, as well as health and sanitation, things like mosquito netting where they're needed, and other things that help people to control disease. Many other notable people have received this award, including U.S. President Jimmy Carter, Russian President Boris Yeltsin, U.S. astronaut James Lovell, and polio vaccine developer Jonas Salk. So I'd ask Eric Stevens to please present your Paul Harris Fellowship to you.
So here is your pin.
Thank you so much. Oh my goodness. Thank you so much. Thank you so much.
One more thing.
Oh,
Yes. And like they say, the infomercials, and that's not, and wait, there's more.
Wait, there's more.
So we also have a local club foundation that we run, and I'm pleased to inform you that our club foundation will be making a $500 contribution to the Foundation of Hope and the Walk for Hope. So congratulations, and Eric has that check for you there.
There you go.
oh my God. Okay, listen, y'all come at me so I can talk.
And let's once again recognize Van.
I want to ask Van to say just a few words about the Walk for Hope, Foundation for Hope. And I just wanted to recognize Kirk Warner, who's off in a courtroom somewhere, some bizarre courtroom setting, and Mary Moss, who's traveling to yet another meeting, doing further volunteer work. I think Bill is probably dutifully driving, but thanks to Mary and Kirk, both past presidents, for their nomination of our distinguished Service Award winners. Van, the podium is yours.
Well, first of all, y'all have made me very emotional because you can receive all kinds of international and national awards, but to be recognized in your own city, I think is the nicest thing ever. And so I just really appreciate this, and I thank you so much for this honor. When I taught school in Kenya, I thought to myself, well, this is all I really want to do for the rest of my life is just do something that gives back, because I loved my students there so much and I loved life there so much. And I realized that these people, as poor as they were, that they were the happiest people and the most giving people I'd ever been around. I also realized that in Kenya, the older you get, the more respected you are in society, which is how I feel it should be everywhere. And teaching is actually one of the most honorable professions that there is in that country, because they realize that you're teaching the youth of the country, which I feel like we could also learn a lot from that too. So when my father became sick and I came home, I thought to myself, well, how, first of all, I had never really run a business. I mean, I had worked as a server, a bus girl, salad department, janitorial staff. I had worked doing everything, but I said, oh my goodness, how am I going to run a business? And so I jumped in because my father had passed away. And then it slowly came to me that, oh, I can receive the same benefits that I felt in Kenya, because through this business, we can give back to the community in so many ways. So I realized that, through a group of 400 employees, we gather together and we can give back to, there's strength in numbers, and we could just give back to so many different groups. So we are involved in so many local organizations that we love giving back to. However, our main organization was started from a tragedy, which proves that through a tragedy can come something great. My brother was diagnosed at a very early age, 45 years ago, with, well, at that time they couldn't diagnose it because they knew nothing about the illness, but it was schizophrenia and chronic bipolar disorder. And so every hospital that my parents took him to, the information that they got was, we know nothing about this illness. There's no research being done about this illness. So my father, in his incredible way of, I can fix anything, he really realized, I can't fix my son. So instead of, since I can't do that, let me start something that maybe can provide what they need the most in this area, which is funding for research. So he started the Foundation of Hope. And it was just a small little foundation that was his own foundation. He had a board of directors. But upon his passing, the employees of the Angus Barn, who absolutely adored him, they started a walk for hope in his honor, because they knew that was the foundation that meant the most. And this year will be our 32nd Walk for Hope. And last year we had a drive-through, but this year it's still touch and go, but I think we're going to be able to do the walk. We usually have about 4,000 people, and 100% of the money goes directly to research and treatment for mental illness. And I just realized that, nothing's really ever a tragedy if you choose to do something great because of it. And so that's what my parents did. And my sister, who runs the foundation, she does an incredible job of running the foundation. And the event is held at the Angus Barn. And we are just so proud of the research projects and some of the local charities that we have funded in this field, because as you all know, especially since COVID, mental illness is such an important topic that there once was a huge stigma around, and now I feel like the stigma has been so much released, but it still needs more. It needs to be released a little bit more, but you know, now people are really able to talk about, because it is an illness. It is an illness that affects your brain and you can't help it. And before, people used to think mentally ill people could help it, but they really can't help it. And so that is what we at the Angus Barn, I have decided that if you own a business, that it should be a law that your business gives back. And so I've just made that one of the most major emphasis that the Angus Barn does. In fact, my controller sometimes meets with me and says, "What in the world are you doing?" We have gone over our max that we are able to do, but I just feel very strongly about that. And I cannot begin to tell you how much I appreciate being honored here today, and that I just didn't realize the three different things that I was going to be receiving, and to know the past recipients, the local ones and the national ones, that just puts me in a club that I'm not sure I really truly deserve to be in, because although Jim did talk very nicely about me, there was no Facebook back then. And so I know we're all very grateful for that. But so there's no proof of all the really kind of bad things I did. Although bad back then was really just good fun. But I was like the leader of the backpack. He won't tell you that. But I had my share of getting in trouble and testing the limits of my parents' patience. But I think it turned out all right. I think if they could see me now, they'd be okay with how it turned out. Thank goodness. But I thank you all, every one of you, because every one of you also give back so much in your own way through your own businesses. And I know you do. And I thank you for your support of the Angus Barn also. And I do want to sincerely tell you that if you ever, and I mean this from the bottom of my heart, if you ever come out to the Angus Barn and things aren't absolutely perfect, I want to know, because that shows that you truly care. And I appreciate it when someone cares enough to let me know that things weren't right. That's the only way that I'm able to fix it and get it right, because I realized in the very beginning, the only way I'm going to make it in this industry, since I don't really know how to run a business, is if I listen to my guest. And so if you have anything that you need for me to know that didn't work out right or didn't go right, you just let me know, and I will figure it out. I will fix it, and I will make it right so it doesn't happen to another person. And thank you so very much. I'm honored. Thank you.
We get a picture of
Sure. I will wear this pin with pride.
Not comfortable.
Hold on, I'll just try to get it all in there. Thank you. Thank you. Oh, and also, by the way, I have brought, I believe they're here. Are they here, Linda? They're here. I have brought everybody something to take home from the Angus Barn, a piece of chocolate chess pie with homemade whipped cream on top, provided with some forks in case you have to eat them in the car on the way. And or if you want to just take them and put them in your refrigerator and save them till 3 a.m. when you'll call me and thank me. But I just wanted to bring you a little something from the Angus Barn so that you could have a little taste of it, since a lot of you maybe haven't been able to go out there in a long time. Thank you.
Jim and Eric for the wonderful presentation. You know, I think about our motto of service above self. And then I think that Van is in the service industry. And sometimes those sound just like words of the hospitality industry. But it certainly takes on a whole new meaning with the way that you treat your guests and the way that you treat everyone at the Angus Barn and all the people that you help through all of your volunteer and community work. So thank you so much. It's a richly deserved award. Now, at this point, I believe we may have a quick message from Christy Santacana about membership.
Good afternoon, everyone. Yes, you have a quick reminder about this month's social, which we're holding in person again. And we're having it this week, this Thursday, May 20th at Mordecai Beverage Company. So that's located at 2425 Crabtree Boulevard in Gateway Plaza, which is pretty close to Linwood Brewing, where we were last month for our social. And we're the HQ Raleigh offices that we went to a while back before pandemic time. So not far from downtown. It's a great place with lots of outdoor parking and lots of picnic tables outside. So hope y'all can make it. We had a great time at our first in-person one last month. And we had a great turnout, about 20 of us out there. So hope to get a bunch out this week. And we will have that e-vite out so you can RSVP just to get a head count to know how many tables to get there early and set aside. Hope to see y'all there.
Thank you so much, Christy. A few announcements. I want to wish Linda Monahan a happy birthday on the 23rd and a happy anniversary to Ron and Gregoria Smith on, that's today, their 50th anniversary. And Bill and Sally McLaurin. Bill, happy anniversary to you all. That's coming up on Wednesday. 48. And Bert and Austin Knoll, that's on the 19th as well. So happy anniversary to you all. I hope you have a wonderful celebration. And at this point, Dr. Eckert has been extremely patient with us. We appreciate it so much. We are now going to get to our program, and Richard Watkins will introduce our speaker.
All right. Congratulations again. It was truly an honor to sit here and listen to how you feel about service. And happy birthday and happy anniversary to all of those celebrating those marvelous events this month. And to Jim's point, it does feel good to be back in person. And a lot of that is made possible, obviously, because of the huge advancements in medicine that we experienced through the vaccines. And one person in particular has been on the front lines of this for a long time. I know that this pandemic has pulled people apart and prevented people from getting together, but I have the fortunate opportunity and luxury to say that I've met friends during this pandemic, and Dr. Carly Eckert is one of those people, and her project and her work has been absolutely instrumental in bringing us to where we are today. So just very briefly, Carly Eckert is a preventative medicine physician, clinical informaticist, and epidemiologist. Carly has worked in health innovation for 6 years, including collaborating closely with data scientists, developing and implementing machine learning solutions in healthcare. Carly has an interest in studying the community health impact from technological implementation, ensuring technology improves access to care for the most vulnerable. Carly is the Chief Clinical Officer at Greenlight Ready, where she works on last mile implementation for public health practice in North Carolina. She is also a clinical advisor in Kinside, a machine learning company for healthcare based in Seattle, Washington. Carly is completing her doctoral work in epidemiology at the University of Washington, where she studies clinical prediction models. Ladies and gentlemen, fellow Rotarians, Dr. Carly Eckert.
Hi, thank you. Good afternoon. Richard, thank you so much for the introduction. Can everyone hear me okay?
Yes. Perfect.
Thank you also for the invitation to be here. It's really wonderful to get to meet you all virtually. I apologize for not being there today. So I'm actually new to the area. I recently relocated to the Triangle from Seattle during the middle of the pandemic. So I've been here a few months, but it's really nice to see all these faces. So I'd like to share a little bit about Greenlight Ready, and let me share my screen. Are folks able to see the screen? The slide? Great, thank you. All right. So I'll just share a little bit about Greenlight. So Greenlight is a Durham-based organization that has been working kind of throughout the pandemic to work with organizations that are based in the community that are reaching the hardest to reach. We all know there's been kind of a disproportionate impact of the virus on groups that are particularly vulnerable. And Greenlight has been working with organizations to help fill gaps in some of the services that have been offered and to move pretty quickly to help out kind of on this front. I'll just share a little bit about kind of how Greenlight started. And Greenlight started within Duke University, actually under another kind of program called the Pandemic Response Network. And this was, really early in the pandemic. Duke was pretty exemplary in terms of how they were able to keep the school open, to keep students in classes with some of their testing and some of their technology, including some symptom monitoring and other programs they had in place. And so what really some of the initial folks with the Pandemic Response Network were able to do is kind of take some of these same practices for the community. And this was, having people report symptoms on a daily basis, kind of having folks be connected to outreach workers around the United States to check in on them and to kind of see how they were doing and if they needed additional services. But what really came out of this is the folks at Duke realized that they weren't necessarily reaching the communities that they wanted to be more intentional for. So Greenlight was actually taken out of Duke. It's independent from Duke, and really began a partnership with community health workers and some other groups in the community. Part of this was also working with IDEO.org, which is a nonprofit marketing group, to really kind of shift the way we were thinking about working within the community. So it was a really eye-opening experience to learn more about kind of the community health workers and how the work is being done in the community to connect people to necessary resources. A key element of this is the community health worker program in North Carolina. For those who aren't familiar with community health workers, they're generally people who live in the community and come from the community in which they work. And they are able to provide really some primary health elements, helping people connect to resources and really being present with people outside of the health system in a way that it's often hard for the traditional health system to engage with. And community health workers are really enormously effective, and they've been around for decades, if not centuries, right? This is not a new program. But during COVID, especially the state of North Carolina put a lot of emphasis on formalizing some of these programs. And so we were able to connect with Cure Americas Global, which is a Raleigh-based nonprofit, and they're the largest grantee for community health worker programs in North Carolina. And really this metaphor is kind of the bridge, right, of connecting people to these resources, to health systems, to really bring these best practices of care out into the community in a way that meets people where they are. And just to reemphasize this, there are so many groups doing this work. There are so many groups that have been instilled in the community for decades, that have been, really putting the sweat into this. And we are there as an additional support to work with these existing programs and to provide really a little bit of technology if it's helpful, or to kind of fill a gap in a program if it's needed along the way. So that's sort of what this speaks to as well, is that many of us at Greenlight, we're a very small team. We're about 3 people, but many of us have a background in healthcare as well as in technology. And so while learning more about the community-based organizations and the groups that are really effective in the community. What we've tried to do is say, how can we help? How can we either, design something quickly that folks can use? Are there common needs across groups that are doing this work that we can take some of that burden? We can, develop a quick program that can help get the work done by supporting these groups. So Greenlight started out actually working with schools and small businesses in Durham. And again, this is kind of hearing common needs in the community during the early days of COVID. So last summer, particularly. And there was a lot of confusion, about where do I find testing? How do I get connected to social resources? Where do I go if I have small children, but I am sick and need help, need medical care, for example? There's also a need for symptom monitoring. So Greenlight developed many different resources to sort of be able to scale these solutions for both schools and small businesses around Durham. And here you can see some of those elements, which included a symptom monitoring application that schools and small businesses could use. So for example, let's say a school signed up to participate, their students would check in every morning with symptom monitoring. I'll show the app in a moment. And that administrator would kind of have a picture or, a dashboard of sort of how folks are reporting symptoms that day. We also worked really closely with leadership from Duke and the infection control prevention folks, and really taking some of those best practices that are hospital-based and distilling them for the community. As many of you know, there's so much information out there, right? Particularly around COVID and best practices and prevention, but it's quite hard. It's quite difficult to kind of distill and to really get to the bottom of, and it's also very disparate. Even for folks with clinical training, I would find myself reading things 2 to 3 times to really disentangle what the guidance was. And so that's something that we took on for these schools and small businesses, is really distilling this to the practical nuts and bolts of what these folks need to do to reduce the likelihood of infection. Talking about things like ventilation and cleaning protocols and masking and symptom monitoring and all of these things. We would be getting daily phone calls from participating businesses like, I've had an employee test positive, now what do I do? Do I have to close? Do I need to shut down, et cetera, et cetera. So we kind of tried to be a resource there for folks in the Durham area. Again, we work closely with community-based organizations and community health workers. So a part of this application was actually allowing people to request a connection to a community health worker. So if folks had social needs or community health needs, actually being able to say, can someone help me find where a food pantry might be open? Can someone, connect me to a nurse because I'm not sure about these symptoms I'm having? So that was also part of the work. We were really fortunate to get to partner with about 16 different schools in the area and about 80 small businesses that were using these different elements. And I cannot emphasize enough really the number of partners that we've been lucky to have. The logos not on here are many of those community-based organizations that we were able to learn from, to work alongside, and to also try to support. This is just kind of a quick snapshot of the application that we used really in the latter half of 2020. I would say those 6 months really before the vaccines and such. So folks, both employees, employers, students, as well as school administrators, really found value in having folks attest to their symptoms on a daily basis, to really report any new COVID-related symptoms they might be having, to connect people to testing when it was kind of hard and confusing to find. And again, really connecting people to those community resources as needed. I'm gonna just quickly go over some of the programs that we also developed kind of over the last 6 or 8 months as well. And again, these might seem a little varied and kind of touching different aspects of COVID, but the goal again is how do we connect people to the resources in the community? How do we sort of take some of the burden off so many of the groups that are doing more than they ever thought they would need to? We had schools who are basically running their own public health departments, right? Schools that are now doing contact tracing and deep cleaning and ventilation, like schools that are thinking about things that are very novel to them. So we aim to, we developed some of these playbooks and scorecards, which, as I mentioned, kind of distilled some of these best practices, allowed folks to kind of benchmark themselves according to really some of these recommendations to see kind of how they stacked up. And folks really liked these because they were very transparent. It kind of gave you immediate feedback on where you could put additional time or resources to kind of improve your current score. We also helped with rapid antigen testing. So some of y'all might have heard that the state actually got millions of rapid antigen tests. So these tests are those that can be done on site, just in kind of the entryway to the nose, and the results are available within 15 minutes. So the state had many of these available for schools who wanted to participate in a program. We were able to, again, kind of take some of that burden off of these schools to kind of facilitate their entry into this program, developing, resources that were replicable and usable for other institutions to participate. So then around, late 2020, early 21, we started doing more work around vaccines and vaccination. Again, working with schools and small businesses to really understand how people were feeling. So many of us, I know, were having anxieties about the process by which these vaccines were developed, really the speed with which they came about, and really trying to hear from folks about, what would make them more comfortable? What is the right setting to receive the vaccine? What kinds of forums do you want to ask questions, and who do you want those answers to come from? So kind of really trying to make sure we were able to meet people where they are. And since then, we've been doing these vaccine town halls, and that's really how I've been so fortunate to meet Dr. Richard Watkins. As he mentioned, it's interesting, all of the friends I've met since I've moved here now have been virtual. I've seen very few of my new friends in person, but it's really been an honor to meet people through this work, particularly Dr. Watkins, whose expertise in virology has been really phenomenal for the community through these town halls. But we have a group of about 16 to 20 town hall facilitators that we've been able to work with. Many of these are physicians, many of these are health experts, some are community leaders who really want to have a role sharing this message, sharing the best practices about the vaccine with the community. And so we've been putting on these town halls. Initially, we started out kind of with open forums, but it really proved beneficial to partner with community organizations to really be invited by folks to come and speak, to share the data and the updates perhaps. So we built on material provided by NCDHHS, and we basically update our content as often as necessary. This weekend, we updated everything again with some of the new guidance. So it's been a really good way to reach people. As I mentioned, I think we've given about 45 of these now in the last 4 months, ranging in size from 2 to about 450. So it's been a really exciting way to also just hear what people are thinking, to hear what folks are concerned about, to hear those questions that people are getting from their community, from their family, from their friends. I think one of the best pieces of feedback I received, and this is actually related to Dr. Watkins, is that someone felt so compelled after listening to one of our town halls that they were able to call their family and talk to their family about the need to get vaccinated, and actually were able to kind of convince them along. So, I think anything we can do to kind of forward this message and to forward these sources of good information is really Greenlight's goal as well. I mentioned kind of how we have been lucky to partner with many local organizations in Durham and surrounding areas. We have offered these in Spanish as well to farm worker groups and churches, and it's been a really amazing way to meet the community. I would say also kind of in these partnerships and supporting these existing programs is with vaccination events, particularly in April and May, when we were really working closely with community-based groups to facilitate vaccination events. And we were just kind of, there ready to help. We were standing up quick online forums to help people register, calling folks to make sure that there was transportation available for folks who needed rides to the vaccination site. So we were kind of there as a resource to work with these community groups that were really doing the hard work in facilitating these events. One of the other kind of common issues that we heard is that it was challenging for folks to kind of navigate that vaccine system. For folks who were eligible initially when eligibility was restricted, it was really challenging for folks without a lot of computer knowledge to navigate that system. And so we stood up a group of vaccine navigators. We had about 20 volunteers that were basically peers of ours, friends of ours that wanted to help people kind of work through the system. So these vaccine navigators could help establish appointments for people, could help folks who don't have an email, help folks who might not have cell phones even. So it was a really great way to really help folks who could use the assistance to get through that process. We're continuing our work with vaccine and kind of vaccine promotion. We're working in Durham with community leaders to coordinate equitable vaccine delivery. Really, again, can't say enough, working with the many community-based organizations that are there and that have been there, and using data in a way that, that we can drive equity. Another really exciting initiative that we're grateful to be a part of is a collaboration with Microsoft Research to work with these community-based organizations to build tools that they can use to, again, facilitate some of the work they're doing. Things like task tracking and, looking at requests that are coming in to community health workers to do things like give people rides or help people make appointments, things like this. So it's really exciting to get to, again, work directly with these community-based organizations and community health workers to help develop tools that will make kind of their jobs easier and really facilitate the work they're doing. I mentioned the bridge metaphor before, and again, there's so many bridges, so many amazing groups that have been doing this work, and we're really lucky to be able to help in any way that we can. We're excited to start looking past COVID. We're excited to think about other ways that this same approach can sort of be used in community health and sort of public health infrastructure. So based on our perspective, this is kind of a disease agnostic approach of really facilitating the resources and really the power of community and community health to promote the community and the people within. So thank you so much for letting me share a bit about Greenlight. I would love to take any questions if there are.
Thank you so much, Dr. Eckert. We have time for a few more questions, but to get us started off, if someone wanted to support the work that you're doing, or if someone wanted to have you do a program for them, how do they reach out to you? What's the best way?
Sure, yeah, I can share my email with the group. That would be great. We'd love to hear kind of what folks think about this model, and if there's areas where we might be able to be helpful.
All right, excellent. For all of those in Zoom land and for everyone here, do we have any questions? Any questions? Zoom land, you're allowed to ask questions as well. I'm trying to monitor that appropriately.
Got one.
I'm good. One.
Sorry.
Just wondering how, first, thank you, Dr. Eckert. How do you feel things are going in convincing the vaccine hesitant to get the vaccine? Do you feel like we'll make good progress towards 70–80% vaccination rate in the US?
That's a good question. I think we are, I think it's going to be continue to be a bit of a challenge, right? I think we're going to need really some specialized outreach for different groups and specialized messaging for different groups, and really with trusted messengers, right? There's been some so much about the messenger is often more important than the message. And so I think really finding those groups, it's been really interesting with these town halls to hear from folks who say, yeah, but my 25-year-old nephew, like it's their group, right, that we really need to think about our messaging for, or it's this group or it's this group. So it's really interesting to think about kind of the different ways we need to be targeting the messages. And so I think we need to get creative. I've heard some interesting things coming out, like the recent initiative in Ohio, for example, where they're having a drawing for $1 million now once a week. So I think it'll be interesting to see which initiatives have different levels of uptake, and kind of how close we can get to that level.
Yeah, that'll be interesting. I'll see if I can get vaccinated for a third time.
Yeah, right.
All right, is there anybody, right? Anybody else with any other questions? All right, please join me again for another round of applause. And with that, I'll turn it over to
Thank you.
Thank you so much, Dr. Eckert, for that presentation. I really learned a lot, and I'm glad that there's somebody there that's kind of coordinating all of this different work to help us navigate through the vaccine. I hope we're continuing to make progress, and I'm looking forward to a fall school season where things will be a little bit different than they have been this spring. I'm certainly looking forward to that for my son who's at NC State. All right, so at this point, it's been a wonderful meeting. It's been so great to see all of your faces in person, to be here in the City Club. Thank you so much to the City Club for your hospitality and for serving us. Thank you so much, Harrison, for filling in for Valerie. You now have the job of substitute Valerie going forward. You didn't know that. But that's the price you pay for helping us out in a pinch there. And at this point, we will close the meeting as we always do with the four-way test. So please join me. We'll stand up. Of the things we think, say, and do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned? All right, folks, we are adjourned.
Everybody, ROT.
That spells Rotary.